Hi, everybody. My name is Dr. Hudson Garrett, President and CEO of Community Health Associates, and I'm joined by an amazing colleague and friend, Sean Kaufman. And I'll let him introduce himself and his organization as well.
Good. Well, thank you, Dr. Garrett. It's good to have you actually here in Woodstock, Georgia. We're here at the Safer Behaviors Training Center, and Dr. Garrett has joined me. He's not only, he's got an extensive list of prerequisites as well, but I will tell you this, it's amazing what you're doing with the community, and I thank you because you're truly an infectious disease pioneer as well. Not only very familiar with the medical industry as an RN, but as a doc, a PhD in, what did you get your PhD in?
Healthcare administration.
Healthcare administration, and he also is serving literally live. He is serving here with the COVID-19. My background's more public health and behavioral psychology, actually. Did 6 years at the CDC and then 10 years at Emory University School of Public Health, and now own a small business since 2014 with the Ebola outbreak, focusing on how human beings and infectious disease kind of interact and react. So how do people behave around it? What's the psychosis of infectious disease? So you may want to tell people a little bit about your background. It's a fascinating background. I know a lot of people listening know your background, but
I really have a diverse focus.
Yeah.
I don't believe, much like you, that healthcare's problems can be solved in a silo. And so it really requires a comprehensive approach that's interprofessional, which is why we're here today, because I know there's a lot of questions about COVID-19 and specifically what's true, what's not true, what are some of the myths. Just as a little aside, we're actually doing a webinar for the Association for Vascular Access at 4 o'clock Eastern Standard Time today. You can find that on my Facebook page as well. But I thought, Sean, we could dive right into a couple questions. And, one of the first ones that we saw was, what's the status of the current outbreak and what are the things that we need to do as members of the public? So maybe if you'll want to tackle the piece about what should people do from a psychology standpoint to deal with being locked down or not able to work?
Well, I think that first and foremost, we need to take a deep breath. The reality is that there is a lot of science. There's a lot that we know about this threat. And for the most part, majority of individuals who are not what I call VIPs, these are vulnerable immunocompromised persons. Majority of the world today, we don't have those kids. Now, we do have to be sensitive because there's a lot of people that live with VIPs. But the reality is that most people, if they come in contact with this virus, most people are going to be okay. So I think take a deep breath. Know that we have lived with infectious diseases for many years. We've lived around infectious diseases for many years.
Right.
But the reality is that this infectious disease in particular seems to love us equally, meaning it likes us. It likes our body. It likes us as a host. But it doesn't treat everybody fairly. It's kind of being a bully. It really truly is affecting some individuals more than others. So I think take a deep breath, know the science, know the facts, not the fear, and make sure that when you decide to do something that's right for you and your family, that you're actually doing things based in science and not this outrage that we're seeing in the world today.
Yeah, I think that makes a lot of sense, which is ironic, the topic of our webinar at 4, which is sort of taking the hysteria out of COVID. From a medical perspective, we always want to go to reliable sources for information, right? So the news media may not always provide that, but going to CDC, NIH, FEMA, some of these federal sources that are providing more real-time updates. My personal favorite website is the Johns Hopkins map.
Oh, I like that
because
too.
I really like that ability to look and zoom down to my community because, as you said, there's places in the U.S. that are not being affected by this, and there's other sort of hot spots, which we've seen like New York State and California and Washington State, that do require a little bit more focus. But we should also think about not just ourselves as patients or healthcare workers, but what about our loved ones that might be in a post-acute care facility like a nursing home? So are there any thoughts that you have about how we can still take care of those folks, but also maintain their humility and sort of that human aspect of the care that they deserve?
Absolutely. Dr. Hudson did bring up something, and I want to come back and touch on that. And we'll go back to what we're talking about. One of the things that Dr. Hudson brought up was the fact that there's a beautiful map on Johns Hopkins that kind of shows exactly what's going on in our community. I think, though, it's extremely important for us to understand that those epidemiological numbers mean something completely different to a scientist than they mean to you. You may, for example, Dr. Hudson, as you know, the numbers are going to surge. We expect the numbers to skyrocket here in the next couple days to come. The Surgeon General even warned that. But ladies and gentlemen, that's not an indicator that things are spiraling out of control. It's an indicator that we're actually listening to things that we weren't listening to before. And what that means is that when we start testing communities and we start throwing tests out like we are, keep in mind, never in the history, not in my year, I'm 47 years old, never since I've been born have we tested for any infectious disease the way we're testing for this. So the fact that we're looking for more, we'll see more. The fact that we're listening, we'll actually start picking up things in the community. And this is a good thing. It's not a bad thing. It means we're going to be able to track the disease better. We're going to be able to get ahead of it better than we were before. So don't be overly alarmed by these numbers. These numbers signify that there is a threat. It affects some people more than others. But the reality is that we can and do better when we learn more about the infection. So again, Dr. Hudson, I know you have some advice on this. Love and touch is critically important. What do we do for the people that are in hospitals? They're receiving chemotherapy. They can't see their loved ones. Long-term care facilities, nursing homes. Dr. Hudson, how do we support them from a distance?
So, to your point, going back to testing.
Yeah.
Right? If we test more, we're going to find more. And if we find more, that's not necessarily going to change any treatment that we offer these people. But when we think about our residents in long-term care facilities, and having been in a long-term care facility this weekend, I've sort of seen the hysteria. Most rooms have windows. There's an opportunity to bring that loved one right to the window, and we've seen some amazing success stories of that. I've also seen nurses that are using FaceTime to bring the patient right to their relative and loved one. And we have to make sure that regardless of the hysteria that's out there, that we don't lose sight of the human connection of care. We know that touch is huge. We know that taking care of our healthcare providers is huge. And when I say the word healthcare providers, we want to be very specific as to who we're referring to. You worked with an amazing group of laboratorians that are processing these specimens. That's never talked about on the news. We have EMS professionals, public safety professionals like law enforcement that are exposed every day. We have correctional facilities. So there's a wide variety. And just on my way over to your house today, I stopped at a gas station and I told the clerk, thank you. And he said, you're the first person that's told me thank you. And he said, I'm coming to work to make sure we can stay open for your benefit as a customer. And I think we need to stop and think about that as well.
Yeah, I agree. And to continue this as a behavioralist, somebody who knows infectious disease, it's part of the healing process to stay connected. And all of us have the power to whip out our phones. We really truly do. Stop looking at more news. Turn the news off. Pick up the phone right now and send a thank you letter to someone out there that you know is doing an exceptional job. Let them know you love them. Let them know that you appreciate them. And if you know a healthcare provider, if you know someone, a healthcare provider, a public health professional, EMS, even laboratorian, if you know someone working day in and day out, someone whose life has truly been heavily impacted by this, please do me a favor. Send them a text right now. Let them know you love them. Let them know you appreciate them. That really is true. Dr. Hudson, let me ask you a question. What could we do for the vulnerable, immunocompromised people? I call them VIPs.
I like that.
What could we do? If you're at home right now and you're healthy, you have no pre-existing medical conditions. You seem to be very healthy. I'm not asking you to go out and party. What could you do for a neighbor who may be a vulnerable immunocompromised individual?
So brace yourself. We're going to start a new concept called common sense.
Okay, that's that's so common these
days. It's something that we don't have a lot of in healthcare, unfortunately. But if I'm well and I'm healthy and my next door neighbor needs groceries, I don't necessarily have to take the groceries in the house. I can leave them at the front door.
That's right.
I can offer to take mail for them or bring their mail to the door so that they are able to stay in sort of a safer isolation stage, if you will. But we also want to make good common sense. If you have a beautiful backyard, go out and enjoy it. Mm-hmm. If you have the ability to walk down the street and can social distance yourselves, go enjoy it. We don't want people to be sort of cooped up inside a residence or a dwelling and lose their mental sanity for some isolationism that we have out there. But we also want to think, too, about how can we warn our healthcare providers that we might interact with that we might be ill. Yeah. And that's a particular topic that's of interest to me. So if you call 911, for example, it should not be to go get tested. It should not be for a non-life-threatening emergency. It should not be for something that doesn't require true emergency care. But if you do call 911, you need to make sure that you let them know that you have shortness of breath, or you have a cough, or you have a fever, or you've traveled outside of the U.S. so that those responders are not unnecessarily exposed. And I think that's another thing that I'd love your perspective on is as professional first responders. What can we do to help them maintain sort of their resiliency during this ongoing crisis that we're experiencing?
Well, I think first things first is we have to also make sure that VIPs are recognized. Agreed. Not only in the community, meaning we need to identify those that need special assistance and protection. We really do. But ladies and gentlemen, I've got good news and bad news. The good news is that we have a lot of VIPs in healthcare, laboratory, and in all the professions that are serving on the front lines with infectious disease. Organizations must they absolutely must identify those VIPs. They must. And they have to make sure they add additional protection for those VIPs. Having somebody who's working on the front line of emerging infectious disease that has a pre-existing medical condition is something we must take care of. And it's right now, it scares me because I think that is quite an oversight. But I would like to also encourage public health professionals, healthcare providers, and laboratorians to do something very, very real. That is set healthy boundaries. You have to be able to turn this off and enter into a safe zone, a zone that allows for you to get some rest and recuperation. Dr. Hudson, I label it like an ATM machine. It's kind of like an ATM machine, withdrawal.
Right.
Well, sooner or later, if there are no deposits made into the ATM machine, it goes bankrupt. And I'm telling you, the worst thing that we can do with healthcare providers today, or public health officials, or even laboratorians, is actually allow them to become bankrupt in a time like this. We need them for a marathon, not for a sprint, but for a marathon. So let's do our best as a community to actually make deposits into those individuals, thanking them, appreciating them, and also making sure they get the protection they need on the front line. So that's critical. What do you think?
Well, I think that's important, and we focus so much about literal personal protective equipment.
Yeah.
But to your point, if we don't focus on sort of that psychological aspect of taking care of ourselves as healthcare professionals, if you're taking care of a patient for 14 hours a day, wearing PPE all of that time, just as a firefighter or someone running into a fire is going to experience burnout. The healthcare workers are going to experience burnout as well. And so it's so important to think about what can we do to help those individuals. Yeah. If you're a healthcare professional, ask your colleagues, are you okay? Is there anything that I can do for you? Human resources departments have a huge role right now to make sure that you can actually reach out to your associates and make sure, is there anything I can do to help you? How can I make this sort of transition to this longer work hours, for example? Another example that comes to mind is I work with a public safety department, and they had several officers exposed this past weekend. Mm-hmm. And that was a fear. I pulled up, and the individual was locked in his car because he was told not to get outside. And so sort of demystifying some of this misinformation is really important.
Yeah, I think, knowing the facts and not the fear is absolutely critical. Right. Dr. Hudson, when is this going to end? I mean, what do you think? I mean, I know I have my ideas. What are your thoughts? What do you think?
I wish I could get my crystal ball out and predict that. And honestly, I think that's going to be self-limited by us. Yeah. And I mean us as a general society, not healthcare workers. But when I drive down the road and the roads are full, we're clearly not listening. When we talk about social distancing and we have people congregated together playing football and other contact sports, we're not listening. And so when we look at what some other countries have done, there are some things that we could learn. And I think, while we're based here in the U.S., this is a global threat with a global solution with global learnings. And so we don't want to be arrogant in the sense that we sort of dismiss other findings from different organizations, societies, and while they may not all make sense for us, it really gives us an opportunity to say, what can we do and adapt here in the U.S., and how can we sort of purpose that for other settings? Because the CDC does an amazing job at putting out guidance. Sometimes that guidance is not as specific to the level of granularity that we need, and I think PPE is another area that I'd love your opinion on, because if I'm a healthcare worker and I don't have PPE, but my employers tell me to run into the fire, what do I do? First and foremost, I think, what can we expect? We're going to be expecting all sorts of things. There's going to be changes, left, rights. There's so much. Be patient and be grateful for what we do know and what we can control. There's much that we can't control. There's much that we can't. And right now, if you're looking at what's going on politically with the news, there's a lot of fighting going on. And to be honest with you, let them fight. Okay, let them fight, and you stay engaged and focus on the people that really need help. But your question, what do we do? Yeah. Look, I'm going to encourage each and every one of you to take control of your own health and safety and do what you feel you need to do to protect yourselves. I don't think that it's fair to put a hero on the front line without the resources they need to protect themselves. However, and this is critical, there will come a time where PPE may be, we're already there, where PPE is a shortage. Now, there is good news. There's hope, ladies and gentlemen. This country is coming together. It may have taken us some time to wake up, but there are people donating masks and PPE. I mean, I've even heard Hollywood's getting involved. I've heard auto mechanics are doing things. Everyone that has a resource is starting to give. And trust me, this country is one of the most giving countries. When we unite, we truly are a very powerful country. And trust me,
Aid is coming. There are businesses that are manufacturing right now PPE. Right. So the reality is if we can hang in there just a little bit longer, take control of your situation, take control of your own health and safety, do what you think you need to do to stay safe, and protect your portals of entry. That's a simple concept. It's common sense positive. If you can do that and hang in there, there will be plenty of resources that will be coming very, very soon and very shortly. I don't think it's a despair. I think there's hope. I agree. Definitely out there.
I agree. And, when you walk into an emergency department and everybody is wearing an N95 mask, for example, including non-clinical workers that are not even in clinical areas, that's an area where we can sort of scale down and say, how do we protect the frontline workers that really need that care? If you're walking down the street, you don't need a mask. And this is something that CDC's repeatedly said. And I think the other thing, too, is to look at the real symptoms, right? And so when we think about symptoms of COVID-19 infection, we're talking about shortness of breath. We're talking about fever, right? We're talking about lung infection. A lot of these patients present to the hospital with pneumonia. And a new one is gastrointestinal upset. And so patients with diarrhea are also sort of in our red flag risk. And certainly if you've traveled outside the country or traveled to a hot area. New York City is a perfect example of that. The U.S. is, I believe, now number 3 in the world as far as new cases. So what would be some advice that you would have for family members that have loved ones that are hospitalized that they can't visit right now?
Oh, that's tough. I actually know someone. My heart goes out. I have just because COVID-19 happens doesn't mean what happens in our world stops. I have a very good friend of mine whose father has just been diagnosed with leukemia.
Right.
And literally is in the hospital right now, and thoughts and prayers go out to him, receiving chemotherapy, and he can no longer see his family. The hospital has been completely shut down. Even though you can give virtual hugs through online systems like they're doing, it is hurting the family greatly to see their father struggle and not be able to be present in that situation. So I don't think that we have a solution that's going to work by being able to provide a virtual hug. But I will tell you, do the best that we can with what we have. And that means connect virtually. And trust me, this is one thing that I love. During the 2014 Ebola outbreak, I was actually, and I witnessed the care of Dr. Kent Brantley and Nancy Ribel in the isolation unit at Emory University, the first 2 cases of Ebola treated in the United States.
Right.
I saw healthcare providers, nurses, give both Nancy and Kent some of the most beautiful, compassionate care I've ever seen. And there is no doubt that nurses, doctors, and healthcare providers around this world are providing compassionate care for our loved ones when we're not able to do so. So trust me, they're there, they're giving it out. They will give it out because they're not only heroes, but because they love what it is they do. So we're going to have to also trust. We're going to have to trust in the healthcare workers.
Well, I like the fact that you remind us about compassionate care, because regardless of what pathogen we're dealing with, we know the route of transmission, right? And when we know the route of transmission, the pathogen essentially becomes agnostic. We can remove it from the equation and say, is this airborne? Is this droplet? Is this contact precaution? And frankly, we do such a bad job in healthcare of general standard precautions. To me, this is an amazing opportunity to say, let's wake up as a healthcare society. Let's wake up as a community. Let's rally together. As you mentioned, I think what businesses are doing is phenomenal. It's the true American spirit, but we also want to make sure that we learn something from this equation. And how do we sort of move that needle forward?
I have to be honest with you. I think that there's going to be a lot we learn. I mean, that's another thing. We learned a tremendous amount in 2014 with Ebola.
Right.
We're going to learn a lot about coronaviruses, ladies and gentlemen. There's hope. There's vaccine idea. There's all sorts of hope that's coming our way. But one thing I got to refer back to Patch Adams, because this is one of my favorite lines in the movie.
It's my favorite movie.
I love it too. But in that movie, he says, listen, if you treat a disease or a condition, you win, you lose. You treat a person, and you always win. And I agree with what Dr. Hudson says. You take the disease out of that equation and you start treating people where they are and with what they have. You treat their heart, you treat their soul, you treat their fears with facts and with love and with empathy. I'm telling you right now, there's nothing that will stop us. COVID-19 will be absolutely defeated if we transition, whether we win or lose, to actually just treating the person right where they're at.
Right, and I go back to sort of the extreme focus that we have, especially in infection prevention land, where we have May, for example, is hand hygiene month.
Yeah.
And then we have another month is caulding month. In reality, let's just do away with that. Let's not focus on hand hygiene just in May. Let's not focus on standard precautions just during a pandemic or something like that. Let's really go back to how do we hardwire our processes, which is why I was so grateful to spend the day with you to think about sort of the human psychology, highly reliable systems that are sustainable so that every patient can benefit from perfect care every single time. And we as healthcare professionals can go home to our loved ones as well.
I agree. And the reality is, as a behaviorist, it's very hard for me because I think we have a pandemic situation of unconscious incompetence. Incompetence. These are people who think they know something that they really don't know. And when you start throwing people into situations with infectious diseases who think they know something they really don't know, you have a problem that's equal to somebody jumping into a swimming pool thinking they know how to swim, and when they get into the deep end, they jump in the pool only learning that they don't know how to swim when they're drowning. Right. And that is a big issue. It is clearly evident with the number of healthcare workers that are getting sick that there's a lot more we can do. Absolutely. We can do a lot more to prepare and protect these individuals, not only against COVID-19, but against all emerging infectious diseases that we see and will continue to see in the years to come.
And I think for those, I see several people that I know watching that are leaders. And part of leadership is defined in times of adversity. And so as leaders, we all have a responsibility to the patient, to ourselves, to our associates, and to our organization. And all four of those are really important. And so we don't want to put healthcare workers on the front line without the recommended necessary steps. That being said, we recognize that we're in times of extreme duress with supply chain. And while Sean mentioned those are being addressed, it's also up to us to make sure that we make good conscious decisions about our own safety. Not running into a fire without a self-contained breathing apparatus is a perfect example. Firefighters don't do that. They plan for safety. And as healthcare, we can learn a lot from our public safety colleagues as well as public health. You know, we went through Ebola, which I can't believe it was only 2014 when you said that. Yeah. But we're going to have something else in a couple more years. And so every opportunity that we have to move this needle forward, I think is really, really important. And I'd like to finish up with one last question as we let you go today, which is, think about what you can do to help the community. I've seen, for example, the American Red Cross, great organization that's advertising for the need of blood. You see healthcare workers that need childcare because childcare centers and schools are closed. But what are some of the things that you can think about from a human psychology standpoint that we could do to help our sort of responding community, whether it's truck drivers or healthcare workers or the mail people?
Look, I think that one thing that, and it's true, you don't mind if I mention this book that
Sure.
I have, right?
Yep.
Okay. So one of the things that I just did, based on the Ebola outbreak in 2014, I've published a book that came out actually in February. This book talks about the use of what we call laboratory or biosafety, clinical containment strategies, and it mixes with what we call the containment strategies or infection control in hospitals. We call it clinical containment. Right. But in this book, I talk about Abraham Maslow. Now, many of us may have known Abraham Maslow. We know it as the hierarchy of needs. Let's take out what we think we know about Abraham Maslow. We're going to throw it out, but we're going to keep his hierarchy of needs. Because you asked a good question. What can we do? Using psychology, the first thing that we can do, and we do this in refugee health, we do this in emergency response, is we must assure that they have physiological needs. Air, food, water, and shelter must be provided. And thank goodness we're in a country that so far has not been impeded. So air, food, water, and shelter, okay? For some people, there are some people that are having a hard time getting food. There are some people. I mean, we're hearing that.
And toilet paper.
And toilet paper, that's true. And that is a physiological need. Okay, I've been assured that by my wife. Yep. All right, the second thing that we have to do is we have to start doing things that give people security and safety of both body and mind. So safety and security of both body and mind is something we have to give assurance. That comes with information. That comes with empathy. That comes with leadership, okay? The third thing we've got to do is give people a sense of belongingness. We've got to ensure that those individuals connect with their loved ones. We want people to connect and connect often. So we're going to promote belongingness. And last but not least, we've got to give people a role in this. We've got to give them a role. We've got to say to them, look, there are VIPs, vulnerable, immunocompromised persons out there who need help. And we need to volunteer to protect these people. And so we got to give people a role. And if we do those things, if we ensure physiological needs, safety and security, belongingness, and give them a role, they're going to feel healthier and going to be more engaged and stronger as we continue. And keep in mind that that's why infectious disease threats will always be a ticking time bomb, because it attacks all basic needs of humans.
Well, and as we leave you today, I want to go back to a couple conclusions that we need to draw. One is that it's not near as bad as it sounds. Two is that there's a lot of hysteria, and some of it's needed and some of it's not. Three, as Sean mentioned, there's some basic parameters that we need to be able to maintain. Buying 200 cases of toilet paper is not one of them, right? And it creates other supply chain issues. Additionally, we want to stop and say thank you. So I see several people that are watching today that are in EMS, fire, police, public safety, healthcare workers, doctors, physicians, laboratorians, and frankly also our public health professionals. And we simply say thank you.
Thank you.
Thank you for what you do. And we hope that you enjoyed this quick Facebook Live. If you're interested in more, we welcome you to comment. And my name again is Dr. Hudson Garrett, President and CEO of Community Health Associates.
I'm Sean Kaufman, a CEO and founding partner of Safer Behaviors.
Thank you very much for joining us, and we hope to see you soon.